New cases of COVID-19 continue to rise throughout the country, even as vaccine eligibility is expanding in many states. And President Biden this week called for states to reimpose their mask mandates as the CDC warns of, quote, impending doom. Joining us now is Dr. Jess Pelletier. He's president of Halodine, which produces a nasal spray that has shown promise in preventing COVID-19. Doctor, it's good to have you here again. Do you believe that a fourth wave of this virus is on the way, or perhaps, dare we say, are we in it right now?
Yeah, aptly as Dickens wrote, it was the best of times, it was the worst of times. It was the age of wisdom, it was the age of foolishness. I think this completely applies to our situation in the country at this point. On one hand, we're doing 3 to 3.5 million vaccinations a day, and this is far beyond what anybody considered that would be possible in the country. But on the other hand, tipping the scale in the other direction of the continued rise of the variants, and as you alluded to, the increasing amount of cases now from a baseline of 50,000 a day, increasing up to 60,000 a day. And a lot of that is driven by both the increase in infectivity of these variants, but also, of course, the fact that states are reopening very quickly. They're abrogating mask mandates and things of this sort. So this is a real problem. I think, though, that we will be vaccinating our way out of this acute phase of the pandemic. I think that with the backstop of the summer, this being mainly a respiratory virus, that our cases will maintain a steady state and, will hopefully, not become as problematic and put the stress on our hospital systems that we've seen in the past.
So then, Doctor, in previous waves, we saw lockdowns being reinforced. We saw curfews being imposed again. And as Alexis was just mentioning, the president also came out and said that we need those mask mandates essentially to be reintroduced. As you mentioned, some of those states that are reopening have gotten away with some of those mask mandates. So then, based on the fact that we are essentially facing and in the middle of this new wave, should we be reimposing some of those lockdowns, some of those mandates?
Well, I don't think necessarily lockdowns, but I think a mask mandate sends a very positive message from the top that, again, this is a respiratory virus. We need to double down on our masks. We need to double down on social distancing. We should discuss perhaps a little bit less about hand washing and talk, more about good, adequate ventilation. There's very little harm in any of those things because it allows us to keep and maintain a lot of our freedoms and act for the best economic interest of our families and in society. So I'm for that. I think it's just a very short time until the more temperate areas warm up in the summer and we're able to really hold this off and, again, vaccinate our way through this steady state or potential beginnings of a fourth wave.
Doctor, there was a lot of hope when AstraZeneca came out with its vaccine because many in the medical community thought that could be the vaccine used globally to get our arms around this pandemic. And now, of course, there have been issues with blood clots. There was a report saying AstraZeneca may trigger a rare immune response that leads to blood clots in some people. And just today, Canada suspended the use of AstraZeneca's vaccine in those 55 and under. What do you think the outlook for this vaccine is? Is it going to be sort of the great hope that we were believing it could be?
Yeah, great question. I still think it's at its heart. It's a good vaccine. It certainly suffered a series of PR gaffes and PR mistakes, which is very surprising from a company as built out as AstraZeneca in conjunction with Oxford. But just for the readers to remember, this is an adenoviral vector-based replication deficient virus with a DNA insert. It's been very effective. It has had some trouble in clinical trials with respect to transverse myelitis. And now these thrombotic events, one characterized as an induced thrombocytopenia and central or cerebral venous clotting issues. I think that if there is a signal here, and this needs to be continually studied and elucidated, that signal will be very weak, and it'll probably be somewhere in the 1 in 500,000 to 1 in a million persons. So it's still a useful vaccine. Now, it may not have that worldwide reach like we really hoped, as the company has, we've counted on them to produce billions of doses of vaccine. But still, in certain populations, in certain countries, it's going to have a very wide utility. So again, I think at its heart, it's still a vaccine. We'd be more than happy to know that we had a vaccine that was this efficacious and created this small amount of side effects.
And Doctor, you mentioned that we are looking at vaccinating our way out of this right now, but we, of course, keep hearing about these variants, these mutations, these strains that are spreading not just here at home, but also worldwide. How much does that weigh on our ability to, as you put it, vaccinate our way out of this pandemic?
Yeah, that's again a great question. As we know, if there's virus anywhere in the world, it can be everywhere in the world. So as we take care of the developed countries and the developed nations, we need to take care of the developing countries and the developing nations. And through arms like COVAX or like the ACT Accelerator, or even perhaps engaging our own production through Pfizer and Moderna to directly distribute to some of these other countries. We need to come up with a better worldwide approach, because this is going to be something that becomes endemic, and there will be pockets throughout the world for many years to come if we don't get a hold on this and start vaccinating throughout the entire world.
All right, Dr. Jess Pelletier of Halodine, thanks so much for being with us today.